Hello, live, 7 o'clock. Facebook Live, I'm here, and it is today. I missed last week because I was on, it was half term, wasn't it? So good to be back, and got some good questions as ever. If anyone's got any questions, please feel free to post them to me directly. And if you're interested on podcasts, this is a podcast on iTunes called the Staiano Clinic. Also, I always forget to say about my YouTube channel. There's a YouTube channel. We've got, I think, a bit depressing actually. Last time I looked, we had 200 and, well, time before last, we had 209 subscribers. Then I looked again and we had 208 subscribers. I'd rather have not had the, not had 209. It went down to 208. Anyway, we've got loads of subscribers. Don't know how many we've got now. Just looking at it here. Oh, 208 again. Okay. 208 subscribers. So if you want to be the 209th subscriber to the YouTube channel, please go over there. There are 208 people, can't be wrong. So I've got some questions here, which I will go through. And if anyone's got any questions, then please feel free to chip in. Khan's giving a big hello, and I'm saying hello right back to you, Khan. Now, before I start, I am going to answer this one over here because I just got it on the Facebook Messenger, so I've got it up on the screen, on the not on your screen, on this screen. So I'll do this one first because otherwise I'll forget. I'm a year post tummy tuck following big weight loss and 2 pregnancies / C-sections. When standing, my stomach is fairly tight / flat, but I have excess / wrinkling when I sit / is the wrong word, sorry. Forward slash. When I sit, is this something I could have further work on, or is it due to the quality of my skin? So this patient's emailed me some photos, which is always very, very helpful and recommended because it's a lot easier to give a comment on a photo. Doesn't really want me to share them because I've now got the facility to share photos. New facility, new in. If you do want me to show the photo on the screen, I can share it. We can do picture-in-picture, split screen. The mod cons on the software you wouldn't believe. You can join in if you want to be. Actually, can you? I think you can. I'm pretty sure you can actually be on the screen with me if you actually want to ask a question and be, like what I am. Anyway, so she didn't want me to share photos, which is fair enough, but I said I would talk about it. So this is tricky. Now, the first thing I would say is there's stretch marks on your abdomen. When you've got stretch marks on your abdomen, that means your skin's been damaged. The elasticity of your skin has been damaged. And so even though when we do a tummy tuck, we make it really tight, it does give over time. And so there's a limit to how tight it can sustainably stay. Sustainably stay? How tight it can stay. So that's number one. There is always a limit to the actual quality of the skin. So if the skin has been stretched, which by definition, if you need a tummy tuck, the skin will have been stretched because that's why you need a tummy tuck, because the skin's been stretched either by pregnancy or weight loss. But there is a bit of excess looking at this, and it's very common for people to say, oh, when I sit, it's okay when I'm standing up, but when I sit down, I get a bulge. Everyone gets that. And if we do something to get rid of the bulge when you're leaning forward, you might not be able to sit up. It'd be really tight to sit up. So it's always difficult to address something when you're in a certain position. Well, we often get people sending us photos saying, look at this bit of skin here. When I go to this angle, I get this bit of extra skin. But then if you're at a normal angle, you haven't got that bit of extra skin. So if you take a bit of extra skin out or the bit of extra fat out when you're in that funny angle, then when you're not at a normal angle, when you're sitting normally, you might have a dent. So you've always got to be a bit careful when you say, like, when I sit down, I get a bulge, because it is slightly normal for that. But having said all that, I can see what you're saying based on the photos. But it's a tricky one. It's a tricky one because the best way to contour the abdomen, the whole abdomen, is with a tummy tuck, with another tummy tuck. But I don't think you've got enough spare skin to warrant another tummy tuck. So the other thing you can do is a mini tummy tuck. But a mini tummy tuck just really addresses the excess skin below the belly button. But you haven't really got much excess skin below the belly button. Although when you sit down, you've got a little bit. But I'm not sure if you'd be happy with a mini tummy tuck, just taking that extra bit of skin I think you really want to have contoured a bit to the side, a bit more to the sides. So the bottom line is, I think, is a very difficult problem, and I think it would be reasonable to quit where you are. I'm not sure if I'm not sure it's worth trying to do extra surgery to make that skin tighter. I think is my advice, because I think it would be. I think another tummy tuck, I don't think you got enough, and a mini, I don't think you'd be happy, because I don't think it would contour your abdomen enough. So I would probably say quit where you are. But as I said to you because I have replied to this to you, it's always best to stick with your original surgeon, work with them, see what you are like in real life. I'm saying you haven't got enough for a full tummy tuck, but you can always, when you examine someone, you can always get a feel of the laxities of the skin and how much excess skin there is there. So that's none of this. Oh, I should have something. I should have a disclaimer, shouldn't I? Yeah, disclaimer. Oh, I should have that as a. That's good, isn't it? Disclaimer. Disclaimer, this is my personal opinion only. So none of this is written in stone. This is just my view. So yeah, I would probably be tending to stick on that. And segueing into that is this other question we got here, which again, this patient has also sent photos. I don't know if she is okay with the. Did I ask? I don't know if I asked. No, I don't think I asked. Anyway, can my tummy tuck be lower? So in terms of lowering my revision scars, do you think this is possible, or am I just wishful thinking? The skin and scar is relatively tight. It's the stretch marks that run through it that bother me so much. So this patient has had, oh, she's had a tummy tuck. I would like the liposuction dog is excising, scars lowering, even just enough to hide them under my underwear, although I'm not sure how realistically. I will have to look for another surgeon to do this, which in itself is quite difficult. It is surprising how many surgeons don't offer revisional surgery. I don't want to bash my surgeon too much. He did a great job on my breasts. With those, for me, I just find this abdominoplasty a bit odd. Anyway, okay, so the bottom line is, can you lower an abdominoplasty scar? I think that's the question. So the answer to that is yes, you can you can lower abdominoplasty scars, although it is difficult. You're limited to how much you can lower it. And the reason that you might have a slightly high abdominoplasty scar in the first place might be because your skin's quite tight. Like this patient's saying that her skin feels quite tight. And that's why the paradox is that people who've got tighter skin, people who've only had maybe one child, two children, hasn't got a huge amount of excess skin. The skin is tighter, so harder to pull down and to get into the bikini line than someone who's got a lot of excess skin, who's had lots of children, who's had lots of weight loss, whose skin has been badly damaged. Just talking a minute ago about the stretch marks. If your skin has been badly damaged and it's really loose and floppy, it's much easier to pull it down lower than if your skin is actually quite good quality and quite tight. So the people who are going to get a higher abdominoplasty scar are the people who have got less excess skin. And so in some terms, you might think they're a better candidate because they're quite fit and they've got good quality skin than someone who's lost a lot of weight, whose skin's been badly damaged. And they are a better candidate and they will get a tighter result and a better contour, but actually the height of the scar might paradoxically be higher than someone who on paper might look like a worse candidate for tummy tuck. So that is the problem. The skin is so tight, it's hard to pull it down. So it's obviously drifted up. The first thing I would say is you've got to leave it. 6, 12, maybe even 18 months. Leave it as long as you can, because often the skin is, the scar might be a bit high to start off with, and then as it softens and settles, it might settle. So that's the first thing, it might settle on its own. You've given me a photo here and you've drawn how much you want it lowered, and you want it lowered quite a lot. It's not going to be able to lower it that much. It's not possible to lower it that much. It is possible to lower an abdominoplasty scar though, but you're looking at a little bit when you lower an abdominoplasty scar, and you have to open the whole abdominoplasty incision. You almost have to do the whole abdominoplasty again. Maybe that's a bit harsh saying that, maybe not. But you know, it's quite an extensive procedure because there's a lot of suturing. So you've got to suture the whole thing down. You've got to suture it in 3 layers, just like you do the first time, because you want to anchor the scar to keep it low. So it is a big deal, and it's marginal how much you can lower it. Again, always best to go back to your original surgeon, because your original surgeon's got a vested interest to get it right for you. Whereas if you have revision surgery with another surgeon, it's all in big surgery, expensive surgery, and you might feel a bit like, well, I've already paid for this operation once. So it's always best to stick with your operation, with your original surgeon if you can. But yes, it is possible, but it is difficult, and you have to be realistic about your expectations. You've got a bit of a dog ear there, which is quite far around the back, and that could be excised, but it would mean the scarring going longer and sort of following the scarring around the back. But yeah, lowering the tummy tuck is possible. Lisa Marie Young, I see you've got very good with the new computers now, Jonathan. Lovely to see. What do you mean now? I've been good with computers always. I'm always good with computers. Talking about, always been, you know, always been good with computers. Thank you. Actually, I was a bit dodgy to start with, especially with this Facebook Live. Roxana's in the house, staunch supporter. Roxana, good to see you here. Going back to question 1 now, I leapfrogged this because it was a tummy tuck thing, and I thought I'd get onto keep it in grouping it together. Can I have an areolar reduction with breast lift, or should I have this separate? So the answer to that is, can I have an area? Yes, you can have a, oh, look at that, I've got myself on. Oh God, I've got myself on. Oh, that's weird. Yes, you can have an areolar reduction with a breast lift. Is moves the nipple, moves the areola, same as a reduction. They move, you move it to a higher place. So as well as tightening the skin, you move the areola, and because you're moving the areola, or the nipple areola complex, you can make the nipple areola complex any size you want. And you usually, to be honest with you, usually do reduce it a little bit, but you can remake it any size. So if you're having a breast lift or a breast reduction, but let's just say breast lift, that's what the question is, an areola reduction is part of it. So don't, so if you say I want an areola reduction and a breast lift, well, that's just a breast lift. Now, this patient has said they don't like the size of their areola, so the areola is too big. And so they could have an areola reduction. If they wanted to then go on and have a breast lift later, they could, but that would be a bit of a waste of money because the breast lift would have included an areola reduction. The only reason for doing it is if your main problem is the size of your areola rather than the shape of your breast. Because when you do the areola reduction, that will make that smaller. Now, some people do a breast lift with that sort of same incision that you get with an areola reduction by taking a donut of skin around the areola and cinching it round. And that's how they do the breast lift. So you only get a scar around the areola. Benelli is the sort of term, as a guy who sort of first talked about it. But it's a circumareolar mastopexy, circumareolar breast lift. So that is a way of doing a breast lift. I don't particularly like it. I don't particularly like that way of doing breast lifts personally. Oh, where's my disclaimer? Oh, I've lost my disclaimer. I should have saved it. I should have saved that disclaimer. Make a note, make a disclaimer. Anyway, disclaimer, my personal opinion. I think there's people out there who do like that sort of breast lift, but I don't. So if you really think the breast shape is a problem, I would just go and have a breast lift. But if it's mainly the areola there's a problem, you could have an areola reduction and you might be happy with that, and then that's it, done. Certainly a lot cheaper than having a breast lift, a lot less invasive, a lot less of a risk of complications because you're not tightening the skin quite so much. And then if you did think, actually, you know what, I do not like the shape, I want to have a lift, you could have it later on, but obviously you'd have to pay again. But if it's really nubbins of problems, shape of breast, then maybe a breast lift would be the way to go, because then that does the areola reduction in one go, if that is clear. Oh, we got, oh, look at that kiss emoji. Hi, Denise, good to see you. Long time no see. Not that long, really, is it? From Tenerife. You're in Tenerife. Wow, look at that. I hope you're having good weather and you mind the sun, because I know what you're like. Be out there tanning and all the, getting all the, you know, it's bad for your skin, that. But yeah, nice to see you, Denise. So, yes, here we go. Can I have an upper and lower blepharoplasty at the same time under local anaesthetic? Hi, I would like to know if it's safe to have an upper and lower eye lift surgery, both done together under local anaesthetic. I have some health issues and can't get general. Again, disclaimer, personal opinion. Second disclaimer, I don't do blepharoplasty, so I don't do eye lifts personally. So again, up to the surgeon. My view is that upper blepharoplasty, local anaesthetic, absolutely fine, no problems at all. I think most people will be absolutely happy with that and no problems. Lower blepharoplasty is a bit of a bigger deal than an upper blepharoplasty, and people do different things when they do lower blepharoplasties. So basically, blepharoplasty is an eyelid. The common one is the bags, you know, bags your upper eyelids, and that is quite common to do that under a local anaesthetic. When you do the lower eyelids and take the bags out of the lower eyelids, ooh, a bit of an itch, then there is a bit more work that is often done, not always, and people will do things with the fat pads. They will do things to resuspend the tissues and try and lift the cheeks a bit. So there's often a bit more work involved with a lower blepharoplasty. So a lower blepharoplasty under local anaesthetic is a bit, now, you're saying you've got health issues and can't have a general. Local anaesthetic and sedation is perfectly reasonable. So I think a lower blepharoplasty under local anaesthetic and sedation is perfectly reasonable, but sedation can come with its own issues. So if you are really not a candidate for a general, then you might, you know, local anaesthetic and sedation is safer than a general, but still it's, you know, got risks because there's sedation involved. I don't know what, you haven't said what your health issues are, but so local anaesthetic would be an option, but with sedation for lowers. But I think it is quite a big deal, often a lower blepharoplasty. The other thing, I guess, again, you have to talk to your surgeon, is to do less to the lower blepharoplasty, to do a less aggressive lower blepharoplasty, maybe not involving so much of a lift to the cheek, which would maybe require less anaesthetic, but then you're going to get less of a result. So you might say, well, hold on a minute, you're going to charge me the same and I'm not going to get as good a result, not pay for that. So needs a discussion, that one. Upper blepharoplasty is fine. Upper and lower, I would say no, unless you are having local and sedation, because it is quite a bit more to do with a upper and lower compared to upper. Denise has burnt her armpit today, guys. How do you burn your armpit? I can't vision. It's like that, isn't it? You've been giving it that. Got to be careful because that doesn't see the sun much, does it? Ooh, that's going to be sore every time you move. Get a bit of after sun on that. Vilma Santos. Vilma Santos. Now that is, you know, X Factor. That is an X Factor name, isn't it? Vilma Santos. Good to see you here, Vilma. I'm honoured to have you. Thanks for dropping in. And you know what else you've done there, Vilma, which I have got on a preordained thing. You know what you've done, Vilma? You've commented. Okay, so that's what I'm talking about right here. Commenting. Where is it? Over there. Commenting and sharing. So thank you, Vilma, for that. Denise is in Reading. Oh, Reading. Gosh, she was in Alicante a minute ago. Now she's in Reading. So Vilma has not only commented and shared, Vilma has got a question. Vilma, not only that, she's commented again. So if I do a tummy tuck, is my C-section scar? We'll go, yes. Sometimes, Vilma, I see patients who've had 2 C-sections and have got 2 scars. I don't get it. I don't get it. If you're having an operation in the same area, we would cut out your old scar. So even if you're having a second C-section, I'd cut out your old scar and you just have one section scar. But if you have a C-section, and obviously it's very common for people to have a C-section scar who are having a tummy tuck, because often people need a tummy tuck after pregnancies, and those two things go together. So it's very common to have a C-section scar. And what we do is we plan our scar below the C-section scar. So the C-section scar gets excised with the sort of abdominoplasty specimen and goes. and then you're left with one scar in the same place as your C-section scar, but it is longer, quite a bit longer, goes from hip to hip. So it's longer than your C-section scar, but it's in the same place. Reading a book. Reading a book. No reading a book. Okay, Denise, no reading a book. No reading a book. Right then. No reading a book. Right. So now you know what's going on now is I've got to be clear about this. You know, it has been 2 weeks, but where I am now is okay, can't find it. Last question. I don't think they've been putting all the questions down, you know, guys. I'm sure I've had more questions. Can this be the last question, for goodness sake? You're telling me this is the last question? Is someone telling? Can someone get some more questions in here, please? It's that last question, is it? Right. Okay. Well, I'm going to get my team to get some more questions in, but if in the meantime, here's the last one. Sissy says hi. Sharon, don't know what that is. Is that a monkey? Don't know what that is. It's an emoji. Always up for an emoji, Sharon. Thank you for that. And you commented, so that's the main thing with a monkey emoji. So why has my nipple reconstruction gone flat over time? So guys, while I'm answering this, if you have got a question, please ask me, because otherwise I'll have nothing to say. Or if you want to join in, you know, you can join in. You know what? If you want to join in, it said, I don't know what that is. I don't know what that is. I think that's a link. What happens if you click on that link? I think that's a link to join me. I'm not sure if I'm supposed to send that to you anyway. Yeah, you can join me, guys. Join me on that link. I should put it in the, will that go as a comment? No, I can comment. Join me. Join me here. Should have put this at the beginning. Comment there. Right, what's going on in the chat? What's going on here? Monkey had TT 6 months ago. Sorry, I was going to do the nipple one. Let's do Sissy. Had TT 6 months ago and have still a lot of skin. What can be done? Sissy, that's a bit, oh, sorry, I've got to get that. Sissy, that is a bit like the, in fact, was that you? I answered on, I don't think it was it? No, I don't think it was you. Just answer someone who said, tricky. So, Sissy, it depends on where it is. So often it's at the sides, and if it's at the sides, like the hips, liposuction is good for those areas. So often we combine tummy tucks with liposuction to these areas. So, but if you haven't had liposuction, then, or maybe if you have and you still got fullness on the sides, then that can help. If you still got excess skin centrally in the middle, then that is a little bit more difficult. And I guess really the only thing to do is to remove that skin, which means another operation and more cuts. And like I said to the previous patient, either a mini full or a full tummy tuck. A mini tummy tuck just takes the skin from the scar, the tummy tuck scar, to the belly button, and a full tummy tuck will contour the whole abdomen. But to do a second full tummy tuck after the first tummy tuck is quite a big deal. But yeah, the revision, talk to your surgeon. If I'm your surgeon, talk to me. I don't think you are. Don't recognize your name unless you're under an assumed name on Facebook. But yeah, just talk to your surgeon and give it time if you're new, if you're not new, if you're recently post-op. But that's a tricky one, and you know, so you get photos and things like that often. Vilma says thank you. Sharon says Denise is reading a book, not reading a book. Denise is reading a book, not reading a book. Guys, in case you're wondering what Denise was doing, that's what she's doing. Yeah, I know, Sharon. I was just doing a bit of a reading sort of, you know, joke on reading. But yeah. In fact, she isn't reading a book. I think she burnt her armpits while reading a book. I think that's where that's what the natural flow should have been. Now that is sticking out. Sissy, upper tummy, hips are fine, middle, ooh, upper. See, upper above the belly button is a tricky one. I'll tell you what, Sissy, there are the non-surgical liposculpturing devices, cool, hot, you know, they propose to give some degree of skin retraction. They might help. Upper tummy, if you've got a bulge in your upper tummy, so if you've got fat and skin, then liposuction might help that. We wouldn't tend to do it at the time of the tummy tuck, but like you could have some liposuction if it's upper tummy. But it's a tricky, so liposuction might help. Maybe some of the non-surgical treatments like cool sculpting and I don't know, there's loads of them. 3D lipo and I can't remember the name of them all, but there's a bit of a Vanquish, Vela Shape. Here we go, they're coming back to me now. Come on, there's more. I know this. Anyway, there are more. There's lots of them. I've looked at them all. What's that one we tried? Anyway, there are lots of them. Bottom line, they might help, and liposuction might help if it's upper abdomen, but it is tricky if you've got extra skin after a tummy tuck. I had a full tummy tuck, muscle repair, Mons lift, and lipo. Big op, that one, Sissy. And yeah, it is tricky. And I think if it's upper abdomen, depending on how much you've got, if you've got loads, then a full tummy tuck again. But to have you're probably thinking, crikey, I'm not having another full tummy tuck. So maybe a bit of liposuction, maybe non-surgical. It's a tricky one. Sharon is, I think that's laughing. Denise thinks I'm funny. Thank you, Denise. Tracy's in the house. Tracy's blushing. Sissy says, I also had a brachioplasty and have spitting stitch. What can I do with it? Tricky problem, Sissy. And what we do when we do these sorts of operations is we use buried stitches. And we use buried stitches to keep the tension of the wound, because by definition, the wounds are under tension, because that's what you want. You want so brachioplasty is an arm reduction for those viewers who don't know what that is. So when you do it, you want to make the skin as tight as possible, like a tummy tuck. And so you worry that because you're stitching the skin tightly, you're worried that the stitches might open up. So you put buried stitches in to keep it nice and tight. And sometimes after time, the body says, I've had enough of this, and starts spitting out the stitches. They're usually vicral stitches, so these sort of creamy white colored stitches, and they spit out, and there can be a little bit of pus there, and people think they're infected and all that sort of stuff. It's usually not infection. It's just a localized inflammation secondary to the presence of the stitches. And usually you don't have to do anything about it, Sissy. It's a bit annoying. It's not very nice. And you might need some local, maybe a dressing or something. You usually don't need antibiotics, but, per disclaimer, you have to get seen by a doctor. If it's very red, you might need some antibiotics, but it's not uncommon. Any of these sorts of body contouring surgeries where we're closing wounds tightly and we're using buried sutures, and you can get a little bit spitting out. And it's, if there is a bit of stitch and thread, sometimes you can remove it, but sometimes it's actually still on a knot. So if it's sticking out, we just tend to trim it to decrease the load of the dissolvable suture. The dissolvable suture usually takes a month or two to dissolve, but that's the suture thread. When you've got a knot, it takes longer because they dissolve by being in contact with water. Water's in your body. When you've got a knot, the bit on the outside might take a couple of months to dissolve, but the bit inside the knot might take ages to dissolve because it's a big chunky knot. And that's why if it takes ages, your body just says, that's it, come on, out you go, and it spits it out. So that's not uncommon, nothing to worry about. Horrible, well, not horrible, but not very nice if it happens. It's a bit of a nuisance, but it's okay. I wouldn't be too worried about it. So we got a question here. Why has it? Sorry, I was answering this one earlier. I've got to get back to it now. This is the oh no, it's not a last. Oh my god. Right, I'll come back. Why has my nipple reconstruction gone flat over time? Morning. I have had 2 nipple reconstructions on the same breast, both of which were great at the time. They both went flat after a time. Why does this happen? I have considered nipple sharing, but now have decided against. Do you know any other methods? I did also have a 3D nipple tattoo after the second reconstruction, which looked fab, but had to have further surgery after that. So tattoo now gone. Thanks. Whew, good question. Good question. I will, if I could thumbs that up, I would, but I can't because I'm on my fancy you know, system where I've got all this stuff. Does anyone click that link then? Is anyone coming on? No? No? Okay, you can come into the lobby. I've got a lobby. Yeah, got a lobby. You can come into the lobby. I'm going to close that. Yeah, if you want to come into the lobby, if you want to share a photo or anything like that. But all right, whatever. Suit yourself. If you want to come in, you're welcome to. I've lost the question now. Is it still there? Okay, so this is a problem with, actually that was the last question, so I don't need the agenda back up. This is a problem with nipple reconstruction. So nipple reconstruction, just to be clear, we're talking about someone who's had breast cancer here. When you do a mastectomy for breast cancer, you often remove the nipple, and therefore have to have a nipple reconstruction. Now, one of the limitations of nipple reconstruction, one of the problems of nipple reconstructions is you are trying to make something that sticks out. You're trying to make a bit of tissue that sticks out. And when the body has a scar, the scar wants to contract. All scars contract, and the scar wants to find the shortest distance between 2 points. And if you've made a nipple reconstruction, the big sort of mountain thing, the shortest distance is a flat line, is to flatten the mountain. So whenever someone has a nipple reconstruction, sometimes they say, oh my God, what have you done? They're ridiculous. It's huge. It's so too big. No one, can I say no one? Pretty much no one, maybe someone, but hardly anyone ever says the nipple reconstruction is too big long term. The problem long term with nipple reconstructions is that they always do what has happened here, which is they shrink, they flatten off. That's the big problem. So if someone first has it done says, oh my goodness me, you weirdo, what have you done? You've made it huge. Don't worry, because it always shrinks. And in fact, the worry is that it'll shrink down to nothing. And you have to have it done again, like this case. So the problem with nipple reconstruction is they shrink. And the reason they shrink is because the scar contracts and it wants to pull that skin down. It wants to go to a flat line. It doesn't want to have a bit of skin that sticks out. So it is a difficult thing to do, a nipple reconstruction. Well, it's not a difficult thing to do, but it's a problem with nipple reconstruction is that they can flatten off. That is one of the very common problems, and so you often need to have it done again. I think a 3D tattoo is a great idea. I don't know, you could always have another 3D tattoo. You said you've gone on to have further surgery and so that's gone or something. One of the problems with doing tattooing once you've done your nipple reconstruction is if you do another nipple reconstruction, and you can always have another nipple reconstruction, that's always an option, although you've had two already, you might say forget that. But once you've had a nipple once you've had a tattoo, if you have a nipple reconstruction, because a nipple reconstruction uses some of the skin to make a bit that sticks out, it will, and if you've had an areola tattooed as a circle, and then you do a nipple reconstruction, it no longer becomes a circle, it looks like a rugby ball shape. You mess up the areola tattoo. So you're best to do the tattooing after the nipple reconstruction. So if it flattens off, sort of do it again. If it flattens off, do it again. And because once you do the tattooing, it messes up the shape. So you might have to do another areola tattoo. But there's no easy answers. There are things, people put a bit of cartilage from the ear. I'm not joking. They put a bit of cartilage in the ear to maintain projection of the areola, of the nipple. There are things we do to try and stop it from flattening off, but I don't think there's anyone that has cracked it. Some people will use the tissue from around the area and then put a skin graft around instead of tattooing the areola to make a skin graft. So there are lots of different ways of, I'm not really answering the question there, I'm just talking about different ways of nipple reconstruction. There's different ways of nipple reconstruction, but one of the risks of nipple reconstruction is they can flatten off. So I can't remember, what was the question? I can't remember, was the question, was there another way of, oh, here we go, got it. Yeah, why does it happen? That's why. Consider nipple sharing, but if you're happy with your other, if you've got big contralateral nipple, if your other nipple is very big and you feel it's too big, then nipple sharing is an option to take apart that nipple and use it as a graft. But if you're happy with your other nipple, then you don't really want to potentially, flatten that one off, and then you have, that's not good. You never want to reconstruct something to look like the bad, the bad thing. You want to reconstruct something to look like the good side. If that makes sense. Do I know of any other methods? Yeah, no really method that is going to reliably give you projection. Probably 3D tattoo is the best thing, and maybe have that done again if it's faded or if it's gone. So what is going on here? Blake, have done that. Is a oh, look at this, got Sharon. Is a tummy tuck with muscle repair similar recovery / pain to a hysterectomy? Good question. That's a good question. You know what? I answer this question, but there must be people out there who've had them both done, so they probably know better than me. I think it's about the same. And there are swings and roundabouts. Hysterectomy doesn't remove any skin. They just make a cut through the skin and do the hysterectomy. So there's no skin excision. So it's not tight. It's not closed tight. You're not bent double. Well, you are bent double because it's a bit painful, but you haven't got a big bit of skin removed and really tight closure like that. So in those terms, a hysterectomy is better than a tummy tuck because you're not removing any skin and you're not closing the skin under a lot of tension. But with a hysterectomy, you're actually cutting through the muscle to get to the womb. So in that respect, it is more invasive than a tummy tuck. It goes much deeper than a tummy tuck. A tummy tuck just stays in the skin. Yes, you even mentioned there about the muscle repair. Muscle repair is not really muscle repair. It's not really cutting muscle and stitching it back together again. You don't cut through the muscle when you do a muscle repair. You just suture the muscle together. The muscle repair refers to your six-packs, your rectus abdominis, your six-pack. The two muscles that go straight down, and they're a bit splayed apart. And so the repair brings them back together again. So it's not like it's divided and you're repairing it. It's just bringing it back together again. Repair probably isn't the right word, to be honest with you. But anyway, maybe perhaps now is not the forum to investigate that. But anyway, so you're not actually cutting muscle, bottom line. You are stitching muscle together. So it does hurt when you cough. It does hurt when you move. And it does make it more uncomfortable when you do a muscle repair, but it's not as bad as actually cutting the muscle, which is what you have to do when you do a hysterectomy. You actually cut through the muscle and you go out the other side in order to take the uterus out. So I think it's swings and roundabouts. They're both about the same, give or take. Hysterectomy because you're cutting the muscle, tummy tuck because you're cutting out a big bit of skin and closing it tight. That's my view. So both are a bit uncomfortable. Tummy tuck, you're a bit more bent double, and it's a bit tighter. Sissy, oh, got some comments. Sissy says, it's not broken, never was red, still under my skin. Oh, still under your skin, that's annoying. So it's not really sort of spitting out, it's just sort of just there. So yeah, that is annoying. Well, if it's, I'd probably leave it. If the skin's intact, I'll probably leave it. But in fact, it's hard for me, this disclaimer. I should get my disclaimer up. Probably see your doctor, Sissy, really. See your surgeon. Because sometimes you can put a little needle in and try and encourage it to come out if it looks like it really wants to come out, if it's formed a tiny little localized abscess or something. Tricky one, that one. Joyce, so interesting, love listening to you. Joyce, loving that comment. Wish I could keep it up there longer, but you know what? I've got loads of other comments. Look at this. About a splurge. Sissy, very helpful. Thank you. Julie, I'm 6 weeks post-op from tummy tuck and lipo. I had seroma, which has nearly all absorbed. Would you recommend massaging or use a roller? A roller. Woo-hoo. Yes, I would. Yeah, I would, Julie. At about 6, well, disclaimer, this is my view. Do what your surgeon says. Don't do what I say. But I tell people at around the 6 weeks, around the 6 week mark, I do tell people to start massaging to help to soften up the scar tissue. I've got to be honest with you, Sissy, to be full. Sorry, Julie. Sorry, Julie. I called you Sissy. It's embarrassing. Can we edit that out? Can we edit that out, please? What I do find, Julie, the best thing for scars, got to be honest, is time. I know all those people who make all the creams and everything are probably going to think, what's he saying that for? But time is the best thing. Now, there are creams and there are massaging and rollers and goodness knows what that people use on scars. They probably do help. But I think for me, it's time. I think massage is good. It doesn't really matter what you use, moisturizer, you know, just to help to break down that scar tissue. But yeah, around 6 weeks, once everything's healed, and if it's all, you know, it's all healed up nicely, then I think, yeah, I would get onto it with a bit of massage. Roller, no harm in it if you want to look at that. No harm, put it like that. I am Sissy. Now, Sissy, I've got you mixed up with Julie. Now, this is Sissy now. Let's get this, be clear about this. Sissy says, I'm 6 months post-op, my skin on my arms still numb. I think that's numb. I I hope I'm reading that correctly. Reading. How long it takes to go back to normal? My arm I think that's scars. My arm scars are very red. What can I do? Again, well, scar management. Right, here we go. So if your scar, so best thing is to say time, and it can. I normally say it starts to start. This is scars anywhere: arms, tummy tucks, moles, whatever. So any scar starts to settle around 3 months. 3 months starts to settle. It can take 6, 12, 18 months for it to really properly settle. So still red at 6 months. I wouldn't be like really worried about that. I wouldn't be writing it off. Sissy, were you having the problems with the stitches? Yeah, you were having problems with stitches. Are you still having problems with stitches at 6 months? Anyway, so the redness at 6 months, don't worry about it. It should still settle. You know, it can take 12, 18 months to probably settle. For me, I think massage is good. Massage, moisturize is good. If they are still quite red, especially if they're a bit lumpy, you can consider things like silicone. Silicone dressings can help. But I think that's really more for the sort of red and lumpy scars. But if it's just, what is it? Is it red? Yeah, very red. If they're red, if they're persistently red, laser is good for red scars. But as I say, usually scars do settle, to be honest with you. But, you know, there are things you can do if they're very red and you want to try and hurry things up. Laser, silicone, massage, all these things can help. But best thing for me is time and a bit of massage. If you're in the shower, you know, a bit of massage with a moisturizer. The fact that your arms are still numb, that can take 9, 12 months for it to come back to life. Numbness is not uncommon for in this sort of surgery, blepharoplasties, tummy tucks, mastopexies. Skin's closed under tension, doesn't like it, feels numb, feels weird. Might not come back to life. There's a risk that it could always be a bit numb, but often does come back to life, but we won't know for 9 to 12 months. But again, I wouldn't worry about that at this stage. But it's probably, again, disclaimer, this should all be really coming from the surgeon, but that's my view on it. Fiona, good to see you here this evening. Hope you're well. Sharon, thank you, was very bent over for almost 2 weeks. Can't remember what we were talking about, Sharon. Oh, the tummy tuck with muscle repair. Yeah, what about a hysterectomy, though? Do you know what a hysterectomy is like? Or was that your hysterectomy and now you're having a tummy tuck? Anyway, so maybe you were bent over with a hysterectomy, in which case that will probably be the same for a tummy tuck. Or maybe. Anyway, bent over for 2 weeks probably sounds more like tummy tuck to me, although hysterectomy I think is a painful when you are bent over to take the tension off the muscle because you cut through the muscle. So bent over for a slightly different reason. But yeah, so I think they're, I would say they're there and thereabouts, but I don't know. Maybe we should do a poll. Let's do a poll. Let's do a poll. I saw a way of doing a poll. Add a poll. I can do a poll. It's probably a bit late in the day for this. Oh, I should have done this at the beginning. Is a which way should we go? Hysterectomy worse than a tummy tuck with this? We need an answer on this, Sharon. We need an answer. So there's only one way to get an answer, and that is let's let the people decide, okay? There's only one way to get an answer on this. The world needs answers, okay? So we've got 3 options. Yes, no, yes, no, about the same. I'm not going to say don't know. If you don't know, just don't say. Live poll. Never done this before. Is that select as the correct answer? How can I select as the correct answer? What? How can it wants me to? I don't. Were we just saying that I knew what I'm doing? Oh, broadcast. How's that? Now, what we can do, guys, check this. Whoa. Go on, vote now. Look at this. What? Whoop. Whoop. That's. Now that is a professional broadcast when we can get that right. Oh, we haven't got any votes. Okay. Anyway, the concept is there. We can do votes on this. But okay. Right. So 0 votes. I wonder if I can vote. I wonder if I can log into Facebook and vote. Can I just vote multiple times to make it look like? Okay. Anyway. All right then. Well, anyway. Thank you. Okay, thank you. Thank you. Julie and Sissy both said thank you, even though I got you mixed up. How do we vote? Do you know how to vote? I'm on it myself here. Boost unavailable. How do you vote? Can you vote? Is it possible to vote? I can't see how you vote. Press the icon next to comments. Press the icon next to comments. Right. Okay. Okay. Well, I'm sure it's because no one else can see how to vote. Has anyone? I don't think anyone's voted. Has anyone got? Oh, one. No. No. What was the question again? Is a hysterectomy worse than a tummy tuck with muscle repair? No. So that's saying that a muscle repair, tummy tuck with muscle repair, is worse than a hysterectomy. It's official, guys. We've got one vote that says, well, hold on a minute. I want to vote. I want to vote. How do I vote? Okay. Right. Okay. Well, I thought it'd be about the same. But we got one vote that says it's not. Says it's worse. Says it's not worse. Says it must. So there you go. It's a tummy tuck's worse apparently. I can't vote. So if you want to vote, anyone, press the icon next to the comments, whatever that means. I don't even know what that means because I'm on it here. There's a circle with lines in next to comments. Circle with lines in next to comments. Okay. Okay. Right. I know what I'm doing. Okay, and I do know what's going on here, but I can't find that. Next to where you put your comment, I've got a smiley face, certain emoji, add a photo, post a GIF, post a sticker. That's all I got. One arrow there. Personal. It have to be personal. Anyway, it's not about me, guys. It's about your vote. 2 people flipping it. That's 200%. We've got a 2. Oh well, we can't argue with that. A tummy tuck with muscle repair is worse than a hysterectomy. I've gone small. I've gone small. Don't worry, Denise. Don't worry. Look at that. I can go big again. What's that you say? You want it even bigger? How's that? Huh? 50-50? 50-50 but big? Yeah, okay. I've got options here. Okay, I've got all sorts of options. So anyway, there you go. I've learned something there. A tummy tuck with muscle repair is worse than a hysterectomy. It's official. The people have spoken, or 2 have spoken anyway. I would like to be able to speak. Press the circle to vote. I can't see a circle. I haven't got a circle. Maybe, anyway. Oh, here we go, comment. Do I have to find that? Anyway, it's not for me to vote, okay? I'm not voting. I'm abstaining on this. This is just for you guys out there. So, so Sharon, so what have you had? Sharon's had, that was a hysterectomy. Tummy tucks on the 18th. Is a hysterectomy worse? So no, the hysterectomy is not worse. And you were bent over for 2 weeks with a hysterectomy. Oh dear. Doesn't look good, does it? No, don't listen to them, Sharon. Don't listen to them, all right? I'm putting a vote for about the same, okay? If I could vote, I would have voted about the same. But everyone's, there you go. Look at that, Sissy, that's the voice of reason. We can rely on Sissy to come in, the voice of reason. Everyone is different. I was very lucky, was never in any pain. There you go. So thank you, Sissy, for that. So everyone's different and you can't generalize, right? So it's, you know, it's everyone's different. But you know what? I would say, in fact, Khan can say it better than me. The tummy tuck is worth it, though. You know, because you know what? The tummy tuck will change your life. Suppose it depends on what and how they take away. Yeah, it depends on you. It depends on, I think, yeah, exactly. I think psychologically it will be, you know, you will have an obvious improvement of your body contour, which will be psychologically beneficial. With hysterectomy, probably less so, because you don't really, you know, just get a scar really. Oh, look at this, Sissy had the tummy tuck and arm it together. Now that's a lot to go through. That is a lot to go through, Sissy. Well done you for having both those two together. So, right, Sharon, I'm not putting that up on screen. Inappropriate emoji use. Right, okay, where's the emoji police? Right, we need the voice of reason back. Here she is. Listen to your body and rest a lot, okay? Sissy is the voice of reason. I think, Sissy, you should be doing this. Sissy, why don't you join the link? You could join me on this, and you could give your voice of reason. Join me, and we could go side by side like this. You could be over there. Or if you don't want to be big, we can just go side by side like that. But let's do it like that. Am I in the way of the thing? 100% say it's not. So yeah, don't listen to them, Sharon. I think everyone's different, and I think you'll be absolutely fine. And you know what? The other thing I would say to you is, if you are in pain after your tummy tuck, bend more. Bend more. Put more pillows under your knees. Bend more, because often it's the tension that's painful rather than the muscle repair. You know, the muscle repair might be painful. Certainly when you cough and things, muscle repair can be a bit painful, but it's often the tension, so bend more. So yeah, Sissy, thank you, because you've stepped in there and given some very good sage advice, and I'm delighted to have used the poll. You know, perhaps, oh, Elaine, right, Elaine, why don't you comment then? Have you commented? Are you one of the two, Elaine? Have you put your vote in? I had a tummy tuck and hysterectomy, and the hysterectomy was hell. The tummy tuck was a bruise. Oh, look at that. Well, get your vote in, Elaine. Get your vote in for so what would that be? Sorry, is a hysterectomy worse? I've already told you hysterectomy was hell. Tummy tuck. So therefore we go. Elaine says yes, the hysterectomy is worse. There you go. Come on, let's get the balance sorted out, guys. Come on, Elaine, don't be shy. Get your votes in. You can't see how to vote either, can you? It's not just me. So can you see how to vote, Elaine? Apparently you have to click a circle by a comment somewhere. I couldn't find it myself. There's a circle with lines in next to the comments, apparently. Don't ask me, I couldn't find it. It's a smiley face, not blushing. You need to read up your emojis. I do, Tracy, I do. I do, my emojis, yeah. Well, I wish you could have seen some emojis that were up on the screen. Well, I didn't put them on the screen. Yeah, earlier, that would be a blushing one. So, oh, here we go. Sissy, I had a really good binder. Helps you standing straight, from Amazon. Best buy ever. Okay, binder from Amazon. There you go. Mine was hell too. I think that's the hysterectomy they're talking about. So yeah, get your binders from Amazon. And yeah, Khan, you said that earlier, the circle next to where you comment. I can't find it. Elaine can't find it clearly because she's not. Oh, hold on a minute. Wait a minute. What's going on? Sorry, I've got to cut to the thing. There has been some no one's saying it's about the same. Elaine's in with a vote there. Redress the balance. So, yeah. Elaine's voted. I don't know how you voted, Elaine. Well, I do. You probably found the circle next to where you comment, which I couldn't find. But anyway, good. So there you go. I think that's pretty comprehensive. I think we could publish that. A hysterectomy. The public say that hysterectomy is actually not worse than a tummy tuck, but Elaine found that it was worse. So that's the. Oh. Get your votes in. Oh, I thought you meant you were trying to get your votes in, because I was going to say I thought you know how to do it, because you're yeah. So yeah, so if you want to know if a hysterectomy is worse than a tummy tuck with muscle repair, the answer is no, it's not for most people, but some people find that it is. So I think that's the answer. I think that's how I'll answer that next time. It's not worse, but some people find that it is. So I think we dragged that out. And they are crazy. It's super painful. There you go. Vote again. Vote again, Elaine. Let's get the balance up. Can you vote twice? Shouldn't be encouraging that because that would be unscientific. Sorry to retract that statement. But yeah, they're both pretty painful ops. So hope that has been helpful. I hope we've answered the important questions there. Any more questions? If you want a poll next week, we can do a poll. If you want to come on live with me and share the screen with me, you can do that. And also, if you want a photo, me to show a photo, I can do that. It's all mod cons here. This is state-of-the-art technology. If you want to go split screen with me, if you think that's too big, and you think, goodness me, I don't want to be split screen that big, well, look, we can go split screen like that. So the options are limitless. If you think, look, I don't want to be center of attention, well, that's fine. I'll be center of attention. You can be split screen up there. But if you want to be center of attention, you can be, and I'll be down there. So all sorts of opportunities for the split screen broadcast facility, polls, photos, and live chat with you in person. If failing that, just send in a question and I'll be happy to answer it. Next Tuesday, 7 o'clock here at Facebook Live with me, and I will get the thing up here. Right, 7 o'clock. So please, there. I know there's a capital I in live, but there you go. And just comment and share. I should have done that at the beginning anyway. Right, see you next week, 7 o'clock. Don't be late. Well, you can be late if you want, actually. Yeah, if you want to come, then please do. And if you've got any questions, post them to me in the meantime, or join me live. See you there. I'm going to check myself out now. Thank you very much for coming. Very, very pleased with the vote, which I'm now going to go like that. And I'm going to end the broadcast. Sleep well. Have a lovely time in Tenerife, Denise. And Boys and Toys, loving it, loving the technology. Take it easy. Thank you for your comments. Thank you for your shares and for your input and your poll results. All three of you. Thank you for that.